Today, we're going to talk about something that's, well, it's a total game changer in how we fight kidney cancer. It's a story that moves away from a one-size-fits-all playbook to something incredibly personal and incredibly powerful. So let's dive into how this new era of medicine is really changing the game.
I mean, just think about that for a second. What if, instead of using a standard blueprint for everyone, doctors could design a treatment based on the unique, specific details of your tumor? This isn't some far-off science fiction idea. It's the reality of what we call precision oncology. So, what is it exactly? Well, think of it this way. Just like every person has a unique fingerprint, it turns out every tumor has its own unique genetic fingerprint that tells it how to grow and survive. Precision oncology is all about figuring out that specific fingerprint and then using it to pick the absolute best weapon against it. It's all about finding the right drug for the right patient.
Okay, so let's start at the beginning. A cancer diagnosis is, of course, a serious thing, and the most common type of kidney cancer you'll hear about is renal cell carcinoma, or RCC. But here's the hopeful part. Our new understanding of the biology of these tumors has just blown the doors wide open to treatments that we couldn't have even imagined a decade ago.
Now, to really appreciate how big of a leap this is, we first have to understand the traditional approach. So let's take a quick look at what's been the standard of care for years and years. For a lot of people, especially when the cancer is caught early, these methods right here are super effective. Surgery, whether it's taking out the whole kidney or just the tumor, is really considered the gold standard. And you've got other options too, like ablation, using extreme heat or cold, or even just keeping a close eye on small tumors. These are powerful tools, no doubt, but they all focus on the physical tumor itself, not on the why, not on what's actually making it grow. And that is where the precision revolution comes crashing in. We're shifting from these broad, physical treatments to something way more targeted. We're now looking deep inside, at the molecular level, to figure out what's fueling the tumor's engine, and more importantly, how to shut it down. The whole thing really kicked off when researchers found a common thread, a kind of pattern, in most kidney cancers. It wasn't just some random, chaotic growth. It was often being driven by one specific genetic glitch. And this is just a brilliant way to think about it. This glitch, which is in a gene called VHL, acts just like a car's gas pedal that's stuck to the floor. It's just constantly screaming, grow, grow, grow. And one of the main things it does is tell the tumor to build all these new blood vessels to feed itself. This discovery was huge because it suddenly gave scientists a crystal clear target to aim for. And this right here, this is the fundamental shift. Doctors aren't just treating a general disease called kidney cancer anymore. Now they can identify and treat something incredibly specific, like VHL-mutated clear cell cancer. That level of detail, as you can imagine, allows for much, much smarter and more precise attack. So what does this actually look like in practice? Let's put the standard approach and precision oncology side by side. You'll really see how this translates into a completely different game plan for treatment. Right from the very beginning, the testing itself is different. The standard way relies on what we can see, right? The tumor's size, its location on a CT scan or an X-ray. But the new way goes so much deeper. It uses DNA sequencing to actually read the tumor's internal instruction manual. This table really lays it all out. With standard care, the main goal is to physically get the tumor out of there. With precision oncology, it's to cut the wires, to disrupt the cancer's growth signals at their source. We've talked about the testing, visual versus molecular, and that leads to totally different treatments, surgery versus these incredibly targeted therapies and immunotherapies. But the customization piece is key. It's not just about how big the tumor is anymore. It's about its specific genetic drivers, its unique fingerprint. All this science and data is fascinating for sure, but what does it actually mean for patients and their families? Well, this is where the story gets really, really good. This is about tangible, life-changing hope. Just look at this number for a second. 93%. For localized cancer, that means cancer that hasn't spread, the 5-year survival rate is now up to around 93%. That is an incredibly powerful statistic. It shows just how good we've gotten at curing this thing when we catch it early. Okay, but what about after surgery? For patients who are at a high risk, there's always that fear, will it come back? Well, get this. These new precision therapies, called adjuvant therapies, which just means they're given after surgery, can lower the risk of it coming back by over 30%. That's a huge deal for long-term peace of mind. And maybe the most dramatic impact of all is what we're seeing in advanced cases. In the past, this was just incredibly tough to treat. But today, with these smart combinations of targeted drugs and immunotherapy, we're seeing many patients achieve long-term remission, living 5, 10, even 15 years or more. That's an outcome that was almost unheard of not too long ago.
So, the bottom line is this: knowledge is absolutely empowering. When you understand these advances, you can have much more informed, collaborative conversations with your healthcare team. So, let's turn everything we've just talked about into an actionable tool for you.
Here are two simple but absolutely vital questions to ask your doctor. First, is my tumor a candidate for genomic sequencing? This is the question that opens the door to a personalized treatment plan. And second, what is my IMDC risk category? This is basically a scoring system doctors use to really understand the specifics of your case and map out the best path forward.
And all of this leaves us with one last, really powerful question. As we get better and better at reading the genetic fingerprints of other diseases, is this super targeted, personalized approach the future of how we treat all cancer? Based on what we're seeing here, that future looks more precise and more hopeful than ever before.